because a lot of us are scared. Like I have gloves on just going in the building because I don't really want to touch anything or anyone.
Yeah, so we actually had to cancel my event next weekend. We were expecting about 100 to 150 people.
You have to do whatever you have to do in order to be safe and to be healthy.
The coronavirus now declared a national emergency. The effect it's having on our lives is undeniable. Schools and businesses are closing. People are being told to work from home. Some of the world's major sporting events canceled. And still so many unknowns about this virus. And we know you have many more questions tonight. And Channel 9 is taking your questions to the experts. This is Coronavirus Questions Answered. Thanks for joining us tonight, everyone, for this special program here on Channel 9.
Over the next hour, we're going to be talking to experts. We're sharing your questions about your health, your money, your workplace, and all the ways coronavirus has affected our lives.
In our studio live tonight, we have Mecklenburg County's Medical Director, Dr. Meg Sullivan. From Atrium Health, infectious disease specialist physician, Catherine Pazzaretti. And Jay Mattier is a business and financial coach. And then Kenny Colbert, the president of the Employers Association here in Charlotte. We want to thank all of you for joining us here tonight.
We do have an important note before we get started. The Charlotte-Mecklenburg School Board is going to be holding an emergency meeting tonight. This is a live look inside that was set to begin at 7 o'clock and looks like they're starting to file in. CMS did say earlier today they want to make sure every student has access to a computer and to the internet in case classes are canceled. Our education reporter Elsa Gillis is inside monitoring this meeting. Will CMS make a call? We'll bring you a live report as soon as we learn about any decision that comes out of this meeting tonight. Tonight really is dedicated to answering your questions. We've been asking what you want to know about coronavirus, and we've been taking your calls and your social media questions.
So now let's bring in our panel and take our first question from Angel Burton of Charlotte.
How much longer is it going to take for them to try and find a vaccination for this disease, for this virus, basically? Because you have a lot of people out here that are afraid to go out of their homes.
And so that first question I want to pose to Dr. Pazzaretti and Dr. Sullivan, can both of you kind of weigh in on that?
Sure. So a vaccine usually can take many years to be developed. This vaccine is being fast-tracked for sure, but still at the earliest, we don't expect it to be available for at least a year to a year and a half. So it's not going to be an immediate thing that impacts the trajectory of this, how this virus is acting.
Yeah, and I think, though, I would just add, I think it's really important to be thinking about vaccines, and obviously we have a lot of people really working hard to get it done as soon as possible because we know in general vaccines do prevent illnesses and save lives. And just to mention that the flu is still widespread in North Carolina, and it is not too late to get your flu vaccine, so if you haven't gotten that, to think about that.
So if there is no vaccine, that means we're going to have to just deal with people getting this and dealing with their health. Potentially people could get it multiple times?
So I think that's still to be determined. There is some data out of Japan that some patients get the infection, seem to clear it, and then get the infection again. It's not clear how that's going to play out as far as we see more in our general area.
Can either of you describe how complex is it to come up with a vaccine? I mean, there's a lot of lab work. You have to identify this and then figure out how to fight it. That takes a lot of time.
It takes a lot of time first to develop the vaccine, and then you also have to test the vaccine. And that testing process is a very regulated process because first you want to make sure that it's safe, then you need to make sure that it works, and then you need to test it. And then even after the vaccine is developed, you need to continue to monitor it for a while. Our vaccines in the United States are incredibly safe, but they're very well tested before they go into market, and that's what we want to do here too.
Right, I know they're trying to fast track it, but you also want to be mindful of that safety as well. Want to go in and take our next question from our viewer, Marquita Smalls.
What kind of gloves? Face mask. What kind of mask? I just want to be safe.
Well, we talked about this a moment ago about the masks and the gloves. You say there's a lot of misinformation about this.
Yeah, I think people feel like they're protected with masks and gloves. Those things are really should be reserved primarily for healthcare workers. People don't realize that there is a way that you wear masks so that you're not contaminating your face, touching your eyes, potentially introducing germs into your body, and that we really need to reserve those masks for healthcare workers.
Yeah, and just to add, I mean, the CDC, the WHO is really not recommending masks for asymptomatic people. They really haven't been shown to work. And as Dr. Passaretti just said, sometimes they actually encourage you to touch your face more, which is we might talk about later as a way that can encourage spread of viruses. And so to really
The people who might want to wear a mask are those who are actually ill. That is effective in controlling your cough and sneeze and preventing you from transmitting infection to another person.
In lieu then of masks, Dr. Sullivan, what should we be doing instead of worrying about putting a mask on? What else about our face should we not be doing? You say just avoid the touching, right?
Yeah, I mean, in particular, we know hand hygiene, right, is really just such an effective way to protect against all viruses, including this one. So washing your hands frequently, either with soap and water for at least 20 seconds or using an alcohol-based hand sanitizer. And really, as we talked about, avoiding touching your eyes, nose, or face with unwashed hands, because that is a way that viruses spread, is incredibly important. Also, staying home if you're sick and really trying to avoid contact with people when you are sick. And if you see someone that is sick, right, to really, again, we've been talking about social distancing and to try and stay a little bit away to avoid spreading that as well.
And as part of that, our school systems have taken action. Lancaster schools closing for the next 2 weeks. Iredell Statesville schools will be closing next week. So CMS leaders right now meeting to talk about this. We know businesses are closing down, events being canceled. So I want to ask Mr. Mattier and Mr. Colbert about how these will impact the workers and our economy with so many things changing and closing down. Mr. Mattier?
Well, it surely will have an impact on the economy and everything, because you have to look, it's a ripple effect. If they close a certain industry, that means those people are going to be out of work. Now, if you take those people that are out of work, they might not have health care, they might not have time to get paid, they might not have vacation time, and then you go back to see how it affects the family. So you move back, they're home, they're trying to, if they don't have the fortunate enough to work from home or Viral or Zoom or something like that. And then you look at the schools. If in fact the schools do anything, then that puts the whole family in jeopardy, because now you have children that are home. You've got to provide daycare for them. You don't know if in fact your daycare provider is going to still charge you. So that's a bill that you're going to incur, but didn't know or didn't realize that you were going to have to do, as well as maintaining the home life and keeping the kids busy and active and doing the things that they need to do. So it is a ripple effect, and it is, you know, contrary to everything that's going on right now as far as the virus goes.
Mr. Colbert?
If the schools close, companies are going to have to take a hard look at their policies. Most companies, or many companies, have leave of absence policies if the employee is sick, but there's no sickness involved in this.
Right.
And so they need to take a look at personal leave policies and how long these may possibly last. The other thing is, a lot of employees are working from home now, but if you've got someone who's taking care of some small kids, they may not have a very productive day working from home. So you need to take a look at that as well. So closing of schools is going to be a dramatic impact on businesses.
Both gentlemen, how confident are you that if people have to go out of pocket because of coronavirus for daycare, that money to help relieve that, whether at the federal or state level, that money can actually get to the people and help them out? And of course, it doesn't help you if it comes in months after the fact when you have to go out of pocket for it.
Well, there's discussion at the federal level, and I think there was some discussion in the House of Representatives today, late this afternoon, about some type of paid leave that's going to be talked. President Trump had mentioned it, and Speaker Pelosi has also mentioned it. So maybe we'll see something related to that take place.
Mr. Mattier, I mean, should people put stuff on credit cards? I know as a financial coach you might not recommend that, but some people might have to go there.
Yeah, I wouldn't recommend it. I would think people need to just stop for a minute and take a deep breath and be calm. This is something that we're going to pass, we're going to get through, but this is the vital importance of people planning for stages like this. One of the things that we like to instill in people as we teach, the emergency fund. To be able to have that kind of money, an emergency that comes up, you have that money to sustain yourself to in case you get laid off. You never have to depend, or you never want to depend on the government to take care of you. It's good that if in fact the bills go through, I know there was a $50 billion bill that went through, the President talked about, that's going to be towards more of the medical industry, but looking out for the actual workers and people, and it's a trickle-down effect. You know, the money might get approved, but again, to your point, how long is it going to take to get down to the people that really need it, and to really be at the vulnerable communities and the people that are really at the risk, your low wage industries or your service industries.
So many layers to all of
Yes.
this. And tonight we're also learning about some additional screening options coming to Mecklenburg County. Novant is actually setting up 2 centers in our area.
We have Dr. David Rentz with us, Medical Director of Emergency Services for Novant. First of all, thank you so much for being here. I want you to describe these 2 screening centers. Getting tested for this has been such a difficulty. How will these centers help out? How many people can get tested?
So thanks for having me tonight. So we've set up 2 screening centers, one that opened today and one that's opening up early next week. These are designed for patients in our community, whether you have a primary care physician or not, and are really wondering, where can I get testing to go and seek care. So the screening centers are designed to really evaluate the patients who are symptomatic, fever and a cough, and whether you meet the CDC criteria, to go there and see if we can collect samples and get those off to testing centers.
And doctor, I know that instead of just showing up, I know that you do want people to make an appointment before they come to one of these centers, correct?
Correct. Ari, you bring up a great point. So probably one of the more important measures that we did today was open up a 1-800 number that's open 24/7, and that's for our entire community. Novant wants to take care of everyone, whether you have a Novant physician or not, and that's really what the screening centers in our community are set up for. The 1-800 number, people can call and see whether they're symptomatic and whether they meet criteria, and really, where do they need to go? Can they go to these screening centers? Can they be referred to a Novant Health primary care physician or a GoHealth urgent care, or whether really you need to come to the emergency department here to receive your care.
All right. Dr. Rentz, thank you for joining us and making our viewers aware of this new aspect of care tonight. We appreciate you joining us.